Hi, I'm Nat from Oasis Hub. Welcome to our series of pre-pilates exercises. So in this series, I'm aiming to just show people the basics of Pilates. So the idea being that if you've come from a history of chronic pain, of a pain spasm loop where maybe you've got poor core engagement, that you've had some pain in the back or the hip, something's gone on for years, maybe you had a bursitis or an accident, a fall, a fracture, and never have quite been the same since. So this series of exercises are a really gentle way to ease back in and start beginning to awaken the body-mind connection again. I would definitely recommend that if you haven't seen a health professional and you've had some sort of trauma or quite serious pain, that you definitely get a health consult first before you engage in exercise programs. But for my clients who I see in the clinic who are already engaging with me and I'm aware of their idiosyncrasies, these exercises are ideal. So the first one we're going to do in our series today is looking at pelvic clocks, and we're looking at knee side and knee tag. So there's three basic exercises I'm going to teach in this sequence. And I like to just show people what muscles are being engaged and exactly the right position for your hips and pelvis and abs to be in, just so you can start to really focus on the connection. Be kind to yourselves if you're starting this program for the first time, because it does take some time to awaken the biofeedback loop in your system. So we're going to start lying down on our back. So I've got a nice thick mat here. This is a 15mm foam, dense foam mat, which is beautiful. But often people can just do this on the carpet at home. So what we're going to do is lie on our back, and we've got our knees bent, which it supports our lower back. We've got feet in line with knees, in line with hips. And I want your toes pointing directly towards the end of the mat. And we haven't got our feet right up close to the bottom. Allow a little bit of space here so the knees feel comfortable. And we're starting in a position that we call neutral spine. And neutral spine allows for the gentle, natural curve of the lower back. So when you're lying in neutral spine, you can feel almost as though you could hold a grape under your lower back, or as a little air pocket under your lower back, and you're not flattening it down. So that's our neutral spine, and that just allows us to not be gripping in the incorrect areas. So with our pelvic clocks, basically it's a rocking in an upwards downward position that we're going to be doing. And there's a particular way we like to breathe in Pilates in order to help engage the deep abdominal muscles. So what I'm going to get you to do is, as you gently allow that curve under the back to slightly exaggerate, we're sending the tailbone down towards the floor and we're inhaling. So I want to feel pelvic floor relaxing, the lungs are filling, the pelvic floor relaxes, we're not gripping through the glutes at all. And then as we exhale, we start to gently pull the tummy down towards the spine, starting to flatten the lower back against the floor now, and the tailbone gently lifts. Inhale, gently arching, sending the tailbone down towards the floor. And exhale, gently engaging. The pelvic floor connects here and lifts up gently towards the belly button. So with our pelvic clocks, you might feel a gentle stretching through the lower back. There shouldn't be any pain doing this. Any pain in these exercises, please stop and get some professional advice. Inhale to gently send the tailbone down towards the floor. Exhale, flattening the lower back and gently lifting just the tailbone. We're not lifting the bottom up into the air. We're not gripping. We're relaxed through the neck and the shoulders, palms facing down on the floor. And I'd like you to do about 10 of these at home. And if you've got lower back pain, this can often be a really nice way to just loosen up the area and help the nerves understand that the emergency is over. So that's our pelvic clocks. We're coming back into a nice neutral spine, so just that gentle, natural curve under the lower back. With our knee sides, we're going to keep our feet in the same position, pointing towards the end of the mat. And I want you to pop your hands just on top of the hip bones and gently inside the hip bones into the lower abdominal area. And we're going to inhale and just gently lower one knee down towards the side. So I want you to think about the hip bones are pointing up towards the ceiling, and as you inhale and lower your knee, we're making sure that we don't rock the hips over to point forward. We're keeping them up. So let's inhale and lower the knee, maybe halfway towards the side, maybe only a third of the way, depending on what the range of movement in your hip is. And as you exhale, we're using the muscles just inside the hip and slightly lower than the hip to bring the knee back into centre. So inhale will alternate to the other side. I'm dropping my left knee to side. Exhale, engaging my lower abdominal inside the hip and bringing that back to centre. So let's continue alternating one side and then the other. The biggest mistake that people make here is engaging their glute and really gripping the bottom to bring the leg back in. So if you're doing that, just be mindful of stopping, having a breath, relaxing the glutes and allowing the inside of the hip, the lower abdominal, to connect. This is stretching our pelvic floor and connecting our pelvic floor, which has a relationship with our lower back and our deep abdominals. So knees side to side. Sometimes it takes a lot of focus at the beginning to get these muscles connecting and to get the glute area to switch off. So then we're going on to our knee tag. So it's just a little extension of what we've done with knee side. I'm going to allow my right knee to drop to the side. Same deal, I want the hips directly up to the ceiling. So we exhale to the side. Inhale, let's bring the left knee over until both thighs are parallel. Take a breath in the middle, we're holding that position, and exhale, I want you to use the lower abdominals to bring both knees parallel back into centre. So we're going to inhale, left knee to side. We're exhaling, we're bringing the right knee over parallel. Inhale to pause, exhale, let's use the lower abdominals to come back to centre. So same thing again here, make sure the neck and shoulders are nice and relaxed. Inhale, exhale. Inhale, exhale to centre. Inhale to side, exhale. Inhale to pause, exhale to come back in. Just being mindful that as you can't bring the knees to the side, we want to make sure the opposite shoulder is staying connected to the floor. It's not lifting and rotating. The goal isn't to bring the knees right down to the floor. It's to get the abdominal connection and some disassociation in the hip, so we're not locked into a hip flexion position. I hope that's helped today, and I'll see you again soon.